same name. You just search for the name and you will reach to that YouTube channel. In that, go to playlist, and in playlist, there are lectures on general anatomy. General anatomy. So what we are doing is, we have already finished those lectures. So in general anatomy, you'll be coming across all these scientific terms and say these names, right? So then you'll find it bit easy to understand any of the lectures. Now today, there'll be so many such names, right? Because the area, what we are about to do is a fora. It is not very complicated, but yes, you need to understand it, right? But see, it's good that you wrote. What I'll do is, I'll try to explain. At any point of time you find it difficult, just let me know. I'll explain that terminology again. So we might have to test Trump's brain. Deepak Chopra's interview, it was wonderful interview. He said there is problem in that person, right? He is an attention seeker. So if the entire US tells that Donu, we love you, so then he'll be coming back to the track, and then he'll say, okay, no taxes, no tariffs on anyone. So it was very cute. Donu, we love you. Girish, okay. Yeah. And Almas, we talked about it. Okay. How much has been completed? I think this is the same thing, this one and this one. See, I got few of the emails where it was mentioned that I missed this lecture, that lecture. See, it's very simple. As per the playlist of upper limb, we are following exactly the same sequence. So in case if you have missed anything now, so even if you go to our shared folder, you find that this specific PDF is there. And in that PDF, the name would be written, let's say session 6 or session 7. So that is what is done, what was done. And you can just go through that video into the playlist. So technically speaking, the academic part, that would be the same. Yes, when we take live, so then obviously some new extra things they keep on coming, but at least you will not be missing the major crux of it, right? Acha, delay in test. Arey yaar, kyun? So many emails. So many emails where you have mentioned that please delay the test. Okay, I don't mind, but अभी के लिए तो I think next week रखनी है test मुझे. I really want to put it. And surprisingly, just 3 emails for the confirmation, right? So spot 1 has been decided, spot 2 has been decided, spot 3 has been decided. But bus, only 3, right? Mail bhejo mujhe, the order in which it will be received, you will be examined on that day, Viva, for the Viva. See, I don't mind if you say कि delay करते हैं, right? But इतना ज्यादा भी नहीं जितना आपने ईमेल में लिखा. I don't want to say that. But 15 दिन तो यार, it is impossible. 1 week, impossible. At the most, 1 gap. I mean, let's say if we meet on Tuesday, so I can give you the Thursday gap, but on Saturday, definitely there'll be that. Not more than this. Because dekho, right from the beginning, I'm telling you that remain with me, right? Every day. Matlab, let's say if we are discussing it for 1 hour, so then spend 1 hour, 2 hours, right? It is medical. No? इतना डिले तो नहीं चलेगा. So I'm really sorry. जितना बोला है आपने उतना डिले won't be possible. We'll see. We'll just keep 1 day gap if you like it. So there was just 3 or 4 responses. 4 responses. Yeah, I just saw that. 4 responses. Regarding this email, whether the physical book should be purchased. हाँ, लेनी है. First year, the basic books, right? The basic books, they should be there. So अपना BD Chaurasia, Inder Beer Singh, right? IBS for the embryology, then Sambulingam, that is for physiology. Those are the basic
Sir,
books.
actually, I'm comfortable in e-books, so can it be referred like that?
Absolutely. If you are, say, I love ebooks, right? Especially after this digital thing, na to bada maza aata hai. Matlab, even if you want to take the screenshot, to take screenshot and. But yes, say when in library, ये तो घर है तो बात अलग है. But say for example, sometimes we like these physical books also. But if you are comfortable with the ebooks, so there is nothing like that. But in general, आई एम टेलिंग दैट यस, फिजिकल बुक्स हो तो ठीक है, होना चाहिए. Regarding the university pattern, those really sorry for that also. When you said that university has started lectures and they are going very fast, it is going to happen. It is going to happen. And I'm not scaring you, but कुछ emails ऐसी भी थी कि the entire upper limb was completed in 4 sessions. In 4 sessions. Yeah, that is in 4 lectures. Brain was completed in 1 week. Now that is like a crime to complete the entire brain in 1 week, right? And 1 week ऐसा भी नहीं कि मतलब सुबह से शाम पढ़ रहे हो. We also finished entire brain in just 2 weeks when in BJ Medical College. But teacher used to take the lectures from morning 9 to 1 and then 2 बजे वापस lunch में से and 2 to 5. That's how things were going on, because brain and abdomen, and they are amazing topics, and so important from the clinical aspect. Yes, this happens. So पहले से तैयारी करना, right? Remain ahead in the class. Other thing what you mentioned is that they have started with abdomen. Happens. ये जो pattern जो बोली है मैंने, कि this is upper limb, then we go for lower limb, then you go for thorax, then you go for say abdomen and pelvis, right, together, then head and neck, and finally the brain. The reason behind it is that we study it in, or I always teach it in this order, because upper limb आपने देखा is very easy, right? The moment if you have started lower limb lectures, you'll find कि हाँ, there is a very good correlation between upper limb and lower limb. It's like just the muscle size has increased, but otherwise things are pretty similar, right? And then when you go for thorax, suddenly you find that there is so much importance of the organs, big organs, right? It is not a heart, these many big lungs. So very easy to understand. When you go to abdomen, you find that the size of the organs is changed. It has become small. Some organs are very small, some are very big. So many nerves, so many blood vessels. Yes, that. When it comes to head and neck, everything is in 3D, because now things are round, right? And it's very small structures. But because of the experience of this entire thing, you'll find head and neck reasonably easy. And then the brain to itself is a completely different ballgame, totally different. I was not even admitted in hospital for a while. The session is not uploaded. Those कौन सा session up? Session तो सारे हैं वंश. All the sessions are there on playlist, right? We are going exactly in the same order.
No, sir, the Thursday lecture.
Thursday को क्या किया था? Thursday को I think we talked about the posterior part, na? Posterior part of that is the extensor component of the arm.
Sir, arm part 2.
Arm part 2. हाँ दोस्त, है ना? ये रहा. Arm part 2, it is there.
Yes, sir, but it is not on YouTube.
अरे मेरे पास
अच्छा.
यहीं पे तो है, YouTube में है. Here it is. See?
Okay, I was referring to other playlists.
कोई बात नहीं. It is there. Very lovingly, what you wrote is, when are you coming to Georgia? I don't know. And then you said, if you're coming, then for how many days? When I go to Georgia, I usually stay for about 2-3 weeks and do take those live lectures. Yes, I'll let you know. What was done? We discussed that. Okay. So that was the thing. Let's start with our today's topic. Very interesting topic. Right? You'll feel so rich by the time you'll finish today's topic. Okay, for time being now, I'll not be answering. Is it possible to increase your system volume? Is the volume okay?
Yes, sir.
Yes, sir.
Yes.
Ovi, just check your volume. And Kunjal, did you receive my mail? If you have sent it right now, पता नहीं, मैंने check नहीं किया. You got your visa, e-visa, October ending or mid, I'll be traveling to church. All right. Okay. Let's start with the forum part 1. The pattern of our discussion would be like this. we'll be discussing today, we'll be discussing the forearm. Okay? We'll be discussing the forearm. Now, this is forearm part 1. That means there'll be forearm part 2 also. But we won't be taking forearm part 2. After taking forearm 1, next time we'll be taking hand. You can say hand part 1, right? Because there is a continuation of that. And then we'll be taking the third lecture in which we'll be discussing forearm part 2 and the hand part 2. So that thing would be taken collectively. So we have got 1, 2, and 3 more lectures. Once we complete that, as promised, I said that we'll be taking one entire session on CT, MRI, NGOs, right? Everything, all the way, right? It is from all the way from chest till the hand. I'll be showing you not less than 15-20 X-rays, CT, MRI, NGOs, everything, right? So that is the point where you'll really feel that yes, whatever you are learning, it is so important, right? And there is such a beautiful correlation between all of them. Okay? So that's for today. This is the forearm part 1. Lots of names would be there, but trust me, by the end of our today's session, you'll be able to remember every name, right? But revision would be very crucial. आज revision miss मत कीजिएगा आप, बस, right? Even if you're not watched the video beforehand, no worries. But don't miss the revision today. For those who have joined recently, when we say, so this is these are your sleeping hours. Revision pattern means just before you go to sleep, you revise. And as you wake up in the morning, you revise. So these are the 2 times when you should really revise. This will make a big impact on your, say, remembering the structures. Not only that, the comprehension. Comprehension is when you can represent it into your own language effectively. Okay, let's start. Here it is. As usual, we start with something which we already know. So this is humerus, radius, ulna, and then there are 8 carpals. She looks very pretty. Try to catch her, right? And the metacarpals, and then there are digits. So these are the major bones of the upper limb. This is the area in which we shall be interested. This is the area. That is, we are dealing with the forearm. That means we'll be taking the lower end of humerus and the radius ulna. They'll be in our prime focus today. On to this. Here is some structures we should really know. So this is the humerus, right? That's the humerus. And this is the proximal end of radius and the ulna. So here we are talking about, this is the elbow, which we are talking about. There is one articular area, right? This is the articular area. Articular area will always be smooth, right? Because that is where the joint is formed and it will be moving very smoothly, right? And this is the condylar region. Condylar region is that region where there will be attachment of muscles, right? And that's why when the fracture is over here, we say it is a supracondylar fracture. Supra means that is above the condylar region. The fracture is there, right? And as we go down, this is what is called as the body of ulna and body of radius. Also, you can say that it is
Shaft.
right? Because these are the long bones. Now, these bones, they have got one very typical speciality. They are not like Siddha Sada bones. When you look at the bones, you'll feel like as if someone has twisted those bones, right? It has been twisted. It occurs because we can do pronation and supination. Because we are doing pronation and supination, so that's why the muscles will be pulling the bones like this, and so that's why developmentally they develop what's called as the twisted bone sort of thing. So here it is. When we'll see these bones, we'll be having anterior surface, right? Lateral surface, because the bones will seem like twisted bones. Let's see with more clarity. Here it is. This, what we are watching is the front, right? So there is capitulum. See, capitulum and trochlea, right? Capitulum and trochlea, they are making what is called as the articular surface, correct? Articular surface. capitulum because it is round, trochlea because it is like a pulley, right? It is like a pulley. So basically they both are articular surface. Then as we go down, right, there is a coronoid process. Now this coronoid process will be going like this because it will be just literally coming in contact with this pulley, with trochlea. So that's why when we move our hand, we can move it so effectively, right? And then there is radial tuberosity, yaad aaya, radial tuberosity, because this is the place where very powerful bones will be attached, muscles will be attached, and they lead to formation of the radial tuberosity. And here is the neck, right? And the way there is a radial tuberosity, similarly, there is ulnar tuberosity. And in between, this is a supinator fossa, right? Supinator fossa. I put some extra images. This is just for the clarity, right? We are dealing with the right hand, right? So as just for the orientation, if you look at this, so here is radius, right? Here is the radius. This one is the radius. So think about, right, your own hand. If this is outside, radius is lateral. So this is the lateral, right? This is like patient is standing in front of us. So that's why when the patient is standing, so this will be the right, his right side, right? This is the right side. So here also, this is the right side. Now this is easy, right? Because we are showing it along with the thorax. So this portion is what we focus on. That's the anterior. And as we rotate, this is what I wanted to show you. That olecranon process, it goes like this. This is how the movements, they really occur. So this is the side view, right? And then here is our scapula, right? That's the scapula. This means this is like
Posterior.
posterior. That's
Posterior.
posterior, right? So just for the understanding that this is how they look like. Time to time, in case if you are not, if we lose our orientation, we'll just come back over here and we'll feel ke haan, barabar hai. Right? This is how it really goes. So this is the groove. This is the groove where which nerve will be passing? Which nerve will be passing through this groove?
Radial nerve.
Medial nerve.
Which one?
Ulnar nerve.
Who said that?
Sir, I.
Shabash. See, where is it? Where is it? Right? When it is on the posterior component, posterior side, you know, posterior side. And this ulnar nerve, this is posterior. Baki to sab aage na, right? The nerves are in front. This is the ulnar nerve which will be on the back side. And this is the nerve which becomes cord-like. This is the nerve which is also called as funny. Funny to kuch nahi, we say it's shocking, right? Lag jaye to dard hota hai. So this is that. Exam में ऐसा ही करेंगे. हाँ. So coming back to this, let's start our journey with the muscles. What we'll do is our policy will be bone to bone. We'll start with the bone. We'll start mounting the muscles one after the another. We'll make the complete forearm and then we'll return. Right, one after the other. Once again, we'll start removing the muscles. So this would be the pattern for all the regions. Sorry. So here is, we are on to the bones, right? Here we are on the bones and first layer which is coming up. And as you can see, this is anterior. बहुत जरूरी, very important. Remain oriented properly. At any point of time, you feel like you are disoriented, stop me immediately, ask. ठीक है? Don't be shy. Okay, मतलब I don't mind आपने जो आप ईमेल भेजते हैं, I surely read that, but कुछ ईमेल पढ़ने पे बहुत मजा नहीं आता. The reason is you asked that question that which was explained 10 times into the class, and मुझे टाइप करने में बहुत मजा नहीं आता. I find it very difficult to type. So that's why in many of the cases I said we'll discuss it in class. Also want to, ठीक है श्रीराज, you are number 5. नहीं, यश पहले, यश का मेल पहले आया. Okay, so we have got now next spots filling up. पर करो ईमेल कर देना. right? I want at least यार कम से कम 30-40 लोग तो appear हो एग्जाम में. अच्छा. So we are starting with bones, and then from bones, the first layer which is coming up. We are into the flexor component, flexor, front, right? This would be the extensor. So in flexor component, we start with the deepest muscle. In deepest muscle, right, there are just two muscles in deep muscles. One muscle, because these are those movements which are occurring by those muscles which are deeply situated. One is pronation, one is supination, right? So supination when the hand is like this, pronation when the hand is like this. So here it is. This is the supinator muscle, see, which is on the top, right? When that muscle contracts, so yes, this is how it will contract, right? And when the muscle which is over here, when it contracts, it will put the hand into the pronation mode. So supination, pronation. We define their name, right, by their action. So this is pronator and this is supinator. Supinator का कोई भाई बहन कुछ नहीं है, कोई नहीं है. So that's why supinator is said, I am supinator. But no supinator, major, minor, कुछ नहीं. Supinator is supinator. Game over. That means there is only one muscle which is for supinator. But pronator has got the surname. Pronator said that yes, this shape is quad shape, so that's why I am pronator quadratus. So that means, is there any bhai bhai of pronator quadratus? Yes.
Yes.
Yes, right? Sir. It will come up. So that's why pronator quadratus. Those who have joined lately, it will always be like there is name and then there is surname. Say, for example, if it is pectoralis, right? Pectoralis. So then pectoralis is something which is on the chest. But if there is major, so that means there would be another muscle called minor, right? Take it for granted. Today you'll be getting that impression multiple times. So here it is, these two muscles done. Let's dive deep. Here it is. Sudden explosion? नहीं कुछ नहीं, बड़ा simple ही है. Right, just now it will be better. So here it is the supinator and here is the pronator quadratus. We put two muscles on that. Now these two muscles, remember these two muscles, they are deep, right? Because there'll be several other muscles which will be coming on its top. But we understand this. This is the radial side. This one would be the ulnar side. Clear? Radial side in anatomical position when we stand. So this side, right? That is our lateral side, right? That is our lateral side. So that is called as the thumb, right? People laugh that thumb is there. So there is no muscle called thambalis, right? नहीं, ऐसा कोई muscle नहीं है. Thumb in Greek language is called as the pollicis. So that's why मतलब थम्बालिस, अंगूठालिस, इंडियन एनाटॉमी नेम होते तो ऐसे ही होते हैं, है ना? But no, unfortunately, it is Greek and Latin. So that's why it is called as the pollex. Pollex means thumb, right? So pollicis. So name will be going accordingly. So here is, these are called as the digits. This is called as the pollex, pollicis, right? पांव का अंगूठा होगा तो it will be called as the hallucis, right? So the names will be according to that. The best is in forearm, every muscle. You don't have to remember कि वो क्या करता है. You just see the name and it will be clear. So here it is. Visually, can you see if I zoom this thing? If I zoom this thing, और कुछ समझ आए ना आए, but at least one thing is clear, that these four, right? These four are together. These four are together. 1, 2, 3, 4. Yes. There is one muscle which is going to 4 digits, right? 4 उंगलियों पे ही जाएगा. And then for our thambalis, right? For thumb, there is a separate muscle. ठीक? So here is seen clearly. So we have named it 1 and 2, 3, 4, 5. So 1 is thumb and 2, 3, 4, 5 is fingers. Now we gave the name to them. Here it is. Huh. So we are dealing with a flexor because flexor group, lateral medial defined, supinator already know, radial thumb pollicis already know, pronator quadratus we have discussed. Now these two muscles, the muscles which are going for digits, fingers. So we'll be calling them flexor digitorum. right? Flexor digitorum. So this is flexor digitorum. Simple na, because we are on the flexor side. But it is profundus. Profundus means big one. Bahut sara, right? So this is enough, so much. Yes. Another important thing is there must be one more muscle with the same name, flexor digitorum. Otherwise, so muscle kaisa bhi ho, bada ho, chota ho, we could have called it just flexor digitorum because there is no confusion. No, but there would be one more muscle which will be doing the same function. So that's why we need to specify, right? वो नहीं कहते यार हमारी बैच में 2 मनोज थे, तो सेम नेम, तो हाउ डू वी आइडेंटिफाई वो मनोज मोटा कहाँ गया, right? So but that's how we used to define, right? And you must also be using that terminology. So, right? So this is flexor digitorum profundus. However, for pollicis, right? This is going for thumb. So we call it flexor pollicis. But यहाँ पे भी थोड़ा लगा. Flexor pollicis longus, right? That means there must be one more muscle which will be having flexor pollicis, and then उसका कुछ pat name होगा. Done. So we are very comfortable with now these 4 muscles. We know supinator, we know protractor quadratus, flexor digitorum profundus, and flexor pollicis longus. Remember with reference to apna haath, flexor pollicis longus and flexor digitorum profundus, right? Fingers and thumb. Done. Let's move further. Now here it is. Pronator quadratus, supinator, already talked about. Flexor digitorum profundus, we talked about. Flexor pollicis longus, wo andar gaya. And on that we have put one big muscle. And this is flexor carpi radialis. अब ये कहाँ से आया? These are the carpals. भाई उंगलियों की बात बाद में, पहले you need to bend the wrist also, right? So before wearing shoes, you have to wear the socks. So obviously, if the wrist is to be moved, so then it has to be more superficial as compared to those finger movements. So flexor digitorum profundus is deeper, and side में से आए flexor carpi radialis. Carpi is carpals. Carpals means wrist. So we need to bend the wrist. To bend the wrist, this is flexor carpi. Radialis, that means there must be something like ulnaris also. Hai. So it becomes easy, right? That means wrist is bent by 2 muscles. Here is a wrist. Think it like that on flexor component, there is one muscle on this side and one muscle on this side. So when this contracts and when this contracts, it means किसी का हाथ ऐसे हो गया है, टेढ़ा, right? So just watch, it's tilting towards flexor carpi, it is tilting towards ulnar side. So that means what is happening? Flexor carpi radialis is not working. Correct? It is the flexor carpi radialis and it is the flexor carpi ulnaris. They both work together so that hand remains straight. Okay? So this is the logic. Both of them, they are working together. So here is the first component, the flexor carpi ulnaris. Look at the size. It is reasonably a big muscle. And now the state of confusion. Kushi, we said this is flexor carpi radialis, and this is flexor digitorum profundus, big muscle, but on that flexor carpi radialis is lying. This is pronator quadratus, wo deep muscle bilkul andar, right? That is also there. And this one is flexor pollicis longus because it is going for the thumb, right? But suddenly, and this is supinator, that is also good. Ye kaun aaya? This one. Well, remember, in case of forearm, because it can do pronation and supination, things will not be clearly defined as जो दिख रहा है सामने. This is flexor and what यहाँ पे है, this is extensor. No, actually on the edge, few of the back muscles will also be coming in the front, right? And this is that gentleman. This one, what we are watching is absolutely the front of the forearm, but side में से, right? this muscle is coming up. This is that long name. It is from the extensor group, right? Carpi means it is for the wrist. On which side it is? It is on the radial side. Radial side, correct? No doubt about it. It is on radial side and it is traveling so long. So that's why longest. That means iska bhi cousin aane wala hai. Correct? So here, what you need to understand is the division is oblique. This red line is the division. This side, flexor side, this side, extensor side, right? This concept, if you have understood, then rest of the journey is absolutely easy. Right? This is the thing which we have to see. That from it forms at an angle. It forms an angle, right? So it is this angle. We are dealing with, remember, this is the right hand, right? Right hand. And the angle is going towards, this is our radial side, and this is our ulnar side. So in your hand, just visualize drawing a line from the medial side towards the where you take the pulse, and then you find that the outer component, that is this component, right? That is where you'll find extensor carpi radialis longus. That means the wrist is dropped, and when this muscle from this side, and it is extension of the wrist, carpi, it is on the radial side, and this is a long muscle. So extensor carpi radialis longus. Jada tension nahi, right? Just one muscle which will be coming into picture. One more muscle might come from the extensor compartment, but we'll take it afterwards, right? But first, we focus on this. So that means now our entire focus will be on this side. Okay? At times you will feel ki aadhe haath ko, why this portion is not given any justice? Because that would be coming into the extensor component. Okay? So from this side, muscles, they will be going all the way to the hand. So that's the reason that we'll be taking, after forearm, we'll be taking the hand. Right? Today also, some portion of the hand will be taken. So there is any confusion when I say supinator? No confusion, right? Deep muscle. Pronator, quadratus, no confusion. When we say flexor digitorum profundus, no confusion. When we say flexor pollicis longus, no confusion. And when we say flexor carpi ulnaris, in सब के ऊपर रखा, no confusion. Regarding extensor carpi radialis longus, एक side में अभी. Let's move further. Here it is. Here it is. 1 minute में सब नाम आ जाएंगे. Just in 1 minute. Do this and do this. अच्छा, उल्टे हाथ से करना. Right? Because we are dealing, we have to watch it in our right hand. So on your left hand, do this. Right? And extend your right arm, right forearm, and then put your hand like this, like this, like this, right? So thumb is inside. Okay. So we have got 1, 2, 3, 4, and thumb is 5th. Okay. So here it is. Pronator teres आया, right? और इसका भाई जो है, it is on the opposite side. So this is the pronator teres, right? So that means pronation. This is supination. Pronation, it has got 2 muscles. Supination. For pronator, we have got 2. Pronator quadratus and pronator teres. Teres means what? Something which is bulky.
Small and round.
Small, right? Quadratus, proper, quad. So here it is the pronator teres, first one. So far, easy. Right? The second one, flexor carpi radialis. So we were talking, right? Flexor carpi radialis, so then there must be flexor carpi ulnaris. Here it is, right? Here it is. So we know that now pronator teres, and then there are 2 muscles over here. One who is going on the radial side, this is flexor carpi radialis. One which is going on the ulnar side, it is flexor carpi ulnaris, right? So these are the two muscles which are always present. This is pronator teres, always present. But then there is one more muscle which is over here. Present in, it is absent in about 10 to 12% of cases. Absent, nahi bhi hota. So chalta hai, right? This is what is called as the palmaris longus. Naam palm, it is going, yahan se shuru ho raha hai, it is going all the way to the palm. So that's why it is called as palmaris, right? And long muscle, so it is long, right? So palmaris longus. Yeah, it is variable. It is variable muscle, right? Sometimes it is not at all present. Sometimes it is very much present. Sometimes it is having few slips absent. All those variations are there. Right? In 10 to 12% cases, तो बिल्कुल भी नहीं होता. Present ही नहीं, तो भी चलता है. So because rest of the muscle, basically what will happen is it will be going to the fascia, right? It will be going to the fascia. So as such, no worries. Even if it is absent, it is not so that person is losing some strength. But yes, we'll be considering it like if it is present, then we should be able to speak all the names in the viva. So all these 5, right? So don't cram, right? Understand. And understand it in this order. कि पहले कौन सा muscle देखा था? Supinator, which was deep. Then pronator quadratus. Means even if you close your eyes, you should be able to visualize के ऊपर supinator. Then there was pronator quadratus. Pronation के लिए 2 muscles. Here is first one, right? This is the pronator teres. Then we have got all the way going towards the radial side. So then there is a flexor carpi ulnaris, right? Flexor carpi ulnaris. So the muscle, visualize it. That flexor carpi ulnaris. From the flexor side, that muscle which is going towards the radial side. So that's why we are calling it flexor carpi ulnaris. Done. And then immediately, if there is flexor carpi ulnaris, flexor carpi radialis, so then there is flexor carpi ulnaris. So ye dono khatam, right? These two are done. And in between, this palmaris longus, right? So we have picked up these 4 muscles. The fifth muscle is, which is over here. We talked about flexor digitorum profundus, right? We talked about flexor digitorum profundus. Profundus was deeply situated. But this is similar, big, powerful muscle. And it is, यहाँ पे तो दिखता ही छोटा है, otherwise it is a big muscle. It has to be big now because flexor components, they are always powerful. Why flexor components are powerful? Because they have to work against the gravity. When they have to work against gravity and plus 5 fingers, means 4 fingers are to be handled. So this muscle has to be powerful. But one was deep, one is superficial. So that's why very nicely we say flexor digitorum superficialis, right? Flexor digitorum superficialis. So it means we have these 5 muscles. Now we'll do one thing. If you wish, you can unmute yourself. You can shout, you can speak, no worries. But we'll be revising in just 1 minute all the muscles, right? I'll wait for just 2 seconds before speaking the muscle name, right? I'll be giving you the hint and you have to speak, right? No worries, bindas, aju baju koi baithe ho, don't worry much about it, right? Let's start. Starting from the bones, there was one muscle which was above. That was?
Supinator.
There was one muscle which was like this,
Pronator quadratus.
right? And then there is one muscle like this.
Pronator
And then there is one muscle. This is
Flexor carpi radialis.
flexor carpi radialis. Very right. Flexor carpi radialis. And then there is one muscle like this.
Flexor
Flexor carpi ulnaris.
And one muscle like this.
Palmaris longus.
Acha. Then for the deeper muscles, for the digits, right? Deeper. What was the name of this?
Flexor digitorum
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 profundus.
profundus. And then there was one muscle which was going.
Flexor
Flexor
pollicis
pollicis longus.
Pollicis longus. And to end this entire thing, there is one cousin of this flexor digitorum profundus, and it is
Flexor digitorum superficialis.
Right? So we are now comfortable with these names, right? These names. So here it is, right? Flexor digitorum superficialis, flexor carpi ulnaris, palmaris longus, flexor carpi radialis, pronator teres, all good. And then extensor carpi radialis longus, उसको बाद में देखेंगे. Right? Let's move further. Here it is. The names which are comfortable: pronator teres, right? Flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis, all good. Just we have to watch two. One, this is the bicipital aponeurosis, जिसने finally सबको ऊपर से wrap कर दिया, right? So that is the bicipital aponeurosis. And there is one big muscle. This is the brachioradialis. This is the muscle which is giving shape to the outer portion of your forearm, that curve, right? When we draw, when we do this, right? So this is the forearm. So this curve, that is the brachioradialis, right? Very powerful muscle. So that is the brachioradialis. So big muscle, brachioradialis, which is onto the radial side. Right? That's why brachioradialis. Brachial, it will be coming from the arm. Right? Done. Let's move further. So all muscles, they are clear. Right? In fact, you have finished the forearm. You know that? You finished it. All the muscles. So here is brachioradialis we remove. So then अंदर से कौन निकला? Extensor carpi
radialis longus.
Right? So now to even this muscle is familiar. And when we remove the bicipital aponeurosis, so this immediately remember this. So we have got first, this is pronator teres. Then we have got the flexor carpi radialis, because it will be going all the way to the radial side. Then we have got that palmaris longus. And finally, it is the flexor carpi ulnaris. Ye khatam. And then there is flexor digitorum superficialis, right? And superficialis, digitorum, so they'll be going for 4 digits. These are the digits, right? Done. Let's move further. This time, watch carefully what we are removing. We are removing pronator teres and the palmaris longus. Pronator teres and the palmaris longus. That means finger 1 and finger 3. So what would be left out? One would be the flexor carpi radialis. Right, here it is. We can now see this is the flexor carpi radialis. Okay. And the flexor carpi ulnaris. So one is, see, is going on this side, one is going on this side. Yes, clear. Right. So going to the wrist, but one will be attached medially, one will be attached laterally. And in between, we find that this flexor digitorum superficial is the boss itna chota nahi hai. We were marking it over here. Flexor digitorum superficialis. Kyun? Because that palmaris longus was covering it. But as we remove the palmaris longus, we find, this is big muscle, right? And then this is so all-time great, apna pronator quadratus. Name itself is naam hi bahut hai, right? We move further. Just to have the proper darshan of this flexor digitorum superficialis, we remove this flexor carpi ulnaris also. So this was covering portion of it. We removed it, right? Now we see that yes, this extensor carpi radialis longus, to wo to wahan pe pada hai, right? Supinator, we saw that because the lone fighter, right, for the supination. This pronator quadratus, yes, that is the quad shape muscle, we know that. And we have got this flexor carpi radialis, that is which is lying, but iski bari aane wali hai. We are about to remove this so that we see this flexor digitorum superficialis. But now you can see that flexor digitorum superficialis is pretty big, right? Going towards all those fingers, right? This is all FDS or the flexor digitorum superficialis. Let's see further. Here it is. This time We removed, as promised, we removed even flexor carpi radialis. इसको भी निकाल दिया. And then extensor carpi radialis longus. Extensor carpi radialis longus तो just show off के लिए निकाला. Because we wanted to see the brother of extensor carpi radialis longus, and this is brevis, chota bhai. So this is the extensor carpi radialis brevis, which is just underneath, right? And so this section, so this way we have smartly learned two muscles, extensor carpi radialis longus and extensor carpi radialis brevis. ये radialis कर रहे हैं. Any guesses? Will there be anything like extensor carpi ulnaris?
Yes.
Yes.
Yes. Right?
Yes,
Otherwise,
sir.
so we would have called it extensor carpi, longus and brevis, but because it would be present even on the ulnar side, that's why. And it is but obvious, if on flexor side we have got the ulnar component and the radial component, so then obviously on the extensor side also there will be radial component and the ulnar component, right? Then and then the wrist can move actually in any of the direction. This is in multi-axial, right? You can rotate your wrist in any of the direction. So we got it, right? Here it is, as we said, that we'll be removing flexor carpi radialis. Flexor carpi radialis removed, and now we see that how big this muscle is. Flexor digitorum superficialis, such a big mammoth muscle all the way, right? Which we were not even considering properly because it was covered. Okay, this is good. And here it is the pronator quadratus, right? It is always मतलब सेल्फी लो तो ऐसा करके सर अंदर डाल देता है. So this is the pronator quadratus seen. This is flexor pollicis longus, the muscle which we discussed previously, right? The deeper muscles, there were only two deep muscles. One was flexor digitorum profundus. नाम में कितना आके profundus, big muscle, right? It is definitely bigger than the superficialis. So that flexor digitorum profundus, and then there was flexor pollicis longus, right? We said that is ये अपना thumbalis वाला, right? So this is flexor thumbalis longus, right? And this is flexor unguialis superficialis. So the pattern would be deep muscles, flexor digitorum profundus, flexor pollicis longus, and covered by flexor digitorum superficialis. Easy, right? So here it is, right? Now you know all muscles. Flexor digitorum superficialis, yes, flexor pollicis longus. Then we have got the ECRB, that is extensor carpi radialis brevis. And on top of it, there is extensor carpi radialis longus. And in between, this is the smart lone supinator. Further. You know them, right? We removed all of them. So here is the beautiful supinator, and here is the pronator quadratus, right? Now we have this small muscle. यहाँ से शुरू हुआ, right? It started from here and it ended over here. Small muscle. So this is extensor pollicis brevis. वापस extensor, हाँ, मतलब लोड ना पड़े आप पे ज्यादा, इसलिए फ्लेक्सर के साथ साथ धीरे धीरे ना एक्सटेंसर के मसल्स भी सीख रहे हैं, राइट? सो वी extensor carpi radialis longus, you know, extensor carpi radialis brevis, you know, and then extensor pollicis brevis, you know. Extensor pollicis brevis, right? Extensor pollicis. Can you collect? Thumb, exactly. Thumb. Very good. Now these muscles, and now we move on to the arteries. For the arteries, right, at one point I'll tell you, you draw along with me so that there is no confusion. So here are the arteries. Here are the arteries. This is our all-time great brachial artery, divides into radial and ulnar, right? And it goes down. Moving further, here it is. There would be anastomosis into the elbow. And there is one artery which will be going up. So that is called as the recurrent artery, because recurrent will be going up and those will be coming, which will be coming from the top, they will be called as the collateral. Right? और यहाँ
Radial
नीचे से जाएंगे, they will be the recurrent. So, but the entire game is of this collaterals and recurrents only. So here is the radial artery. This is the radial artery. This is the ulnar artery. Radial is sending one branch up, so that's why it is very nicely called as the radial recurrent artery. Right? It will be going up. Meantime, from the ulnar, there is one very important artery which will be coming out, and this is common interosseous artery. See this artery, interosseous, it is going between two bones, right? So yes, that is what is called as the interosseous artery. This is typical. So examiner can ask question on this because this is very typical. So it is the ulnar which is giving one branch, common interosseous artery. Common interosseous artery, this is anterior and then there is posterior. Two are there. So let's move. What? Here it is. CIA, right? It is not Common Investigation Agency or Crime Investigation Agency. It is our common interosseous artery, anterior and the posterior. These are the branches of CIA. True. This figure आपको डराने के लिए. In exam also, this figure can come. So you might be asked, identify the structures. So first what you'll do, which side is lateral and which side is medial, right? Once, don't worry, right? Which side is medial, which side is lateral. This is how you should approach, because what examiner can do, every time we are learning right hand, right? See, मतलब मैं paper leak कर रहा हूँ. Every time we are dealing with the right hand. What if दिमाग में आया कि चलो एक काम करो left hand? Right? Because with this impression, अरे ulnar यहाँ पे, median यहाँ पे, पूरी कथा कर दी, and then finally, अरे this was the left hand. So don't make that mistake, right? Always figure out which side is medial and which side is lateral, right? So that you never commit mistake. So orientation, this is what is called as the orientation. This would be very, very vital. Right side, left side, anterior, posterior. But once you have identified that, so then it is easy. So that's why when the question is asked, you will straight away say that we are watching the anterior view of the right side. Bus. So now examiner knows that bus, you are properly oriented, right? You cannot be tricked. So that's how you start. Right? So now this is the lateral end, right? Lateral end or the radial. So now we need to identify which nerve is this. So there is no doubt about it. This is the radial nerve, right? Itni bhaiya now radial nerve coming all the way from posterior cord. Posterior cord, and then it gives branch. That branch which travels into which groove? Radial. Along with
Profunda brachii.
Profunda brachii.
Everyone can speak profunda brachii, and then it pierces what?
Lateral intermuscular.
Muscular septum.
Yes, and then it becomes anterior, and it is at this point it will be giving deep branch and the superficial branch. Deep branch to कहने के लिए है, it gives cutaneous supply and khatam. इसका काम खत्म, right? It is the superficial which continues, right? And we'll talk about it. So done. Radial, to now you are very confident. I know that. And then comes this one more branch. This is the musculocutaneous. Musculocutaneous is branch from which cord?
Lateral.
Right? It will be supplying this coracobrachialis, biceps brachii, and the brachialis. And this star indicates
It pierces coracobrachialis.
Pierces through
coracobrachialis, right? And this musculocutaneous, because these are the muscles, and this is the cutaneous, so it is also called as the lateral cutaneous nerve or forearm. So after supplying to all those muscles, it will be continuing as lateral cutaneous nerve of forearm. Done. Then comes only two nerves are left out. One, the ulnar. ये तो कभी भूल ही नहीं सकते. In case if you forget, just tap your back and then feel the pain, and then you will say, aha, ulnar. Right? So this is the ulnar. They say this is funny. Sorry. So this is ulnar, right? And this is the ulnar, and which goes on to the posterior side. And then in front, it is the median nerve, right? Very important, and it will be playing important role as it will move further. So done. we have dealt with all those nerves. This is what you have to really draw. Right? It is pretty easy. Here is the brachial artery. Here is the brachial artery. Brachial artery gives branch, right? It is not in proportion, just for the understanding. Brachial artery, it gives this profunda brachii. Profunda brachii it gives, and this brachial artery, it divides into two, and that is the radial and the ulnar, right? Radial and the ulnar branch. What we are about to discuss is the anastomosis. So it gives one branch which goes above, right? It goes up. So that's why we'll be calling it recurrent. कौन सी sides पे है? Radial. So we'll call it radial recurrent artery. Simple as that, right? And then this is the profunda brachii. Profunda brachii is giving one branch below. So that branch is called what?
Radial
Collateral.
collateral.
Collateral. It is on radial side. Radial collateral. So now how fantastic it looks that if I say that explain the anastomosis onto the cubital joint on the radial aspect, right? But very royally you will say that it is the radial collateral artery, which is the branch of profunda brachii, and it anastomosis with radial recurrent artery, which is the branch of radial. Right?
Radial artery.
हाँ रेडियल आर्टरी. किसी के साथ झगड़ा हो तो यू जस्ट से दैट दीज थिंग्स, राइट? वो बोलेंगे कि यार ऐसी गालियां नहीं बोलने की, बाकी कुत्ता गधा कुछ भी बोल दो, राइट? बिकॉज नो वन वुड अंडरस्टैंड दिस. स्टिल इफ द बहुत बड़ा झगड़ा हो तो देन विल कम ऑन द अल्नर साइड, जब उसका दिमाग खराब कर देते हैं, राइट? दिस इज व्हेन देयर आर टू ब्रांचेस फ्रॉम द ब्रेकियल अबव and there are two branches from the ulnar. Now this is for bigger fight, right? See how it goes. Ulnar collateral, simple, because it will be going from top to bottom. Ulnar recurrent, yes, because both of them, they will be going up. Ulnar collateral, they are superior inferior, right? Because this brachial is the seedhi artery, right? It is going like this. If two branches are to be taken out, so one would be above, one would be below. So one is superior, one is inferior. Makes sense. But when it goes down, right? So then this is the ulnar artery. One artery goes anterior, one artery goes posterior. So that's why this is anterior posterior. To make this concept still better, what I've done is I have put this one extra figure. This is not on YouTube, right? I just put it today only. See, पहले बताओ, which artery is this?
Radial recurrent artery.
Shabash. Those very good. Radial recurrent artery. Very good. Which one is नाम देते जाते हैं? One. Which one is this two?
Radial
Radial
collateral.
collateral.
Acha. Now let's come on ulnar side. On ulnar side, this is, so this is two. Let's name it as three. This three one is what? Third one is what?
Superior
ulnar
Radial ulnar collateral artery.
Very nice. Superior ulnar collateral artery, right? Sukha. And this is
inferior
ulnar collateral artery.
inferior ulnar collateral artery. All right. About, so this is 4. Let's say this is 5. This 5 is
anterior
अब दिखता है.
current artery.
Now this is anterior ulnar.
recurrent
Recurrent artery.
क्या अच्छे अच्छे words बन रहे हैं. Aura, right? And this one is
posterior
anterior ulnar recurrent artery. So this is Aura. And now what's the big deal? If we say that who will be anastomosing with what, right? यहाँ पे जो draw किया है, right? Here this was a very crude drawing where we say this is the anterior, right? This is the anterior recurrent ulnar artery will be anastomosing with inferior ulnar.
सर
collateral.
वो recurrent क्यों बोलते हैं एक बार वापस बता
Recurrent.
सकते
My mistake. That's it. Right. So this is the anterior recurrent, that is apna aura, right? So anterior ulnar recurrent artery, that will be with inferior ulnar collateral, right? This makes sense, right? So यहाँ पे, when we watch this, yes, this is very clear. It is this which is anastomosing with this. And this superior ulnar collateral, that is going back with posterior ulnar recurrent. Correct? So this with this. Done?
Yes.
And this CIA posterior inferior. Now, no need to explain, you know all of them, right? Right. Recurrent artery, radial recurrent artery, anterior and posterior ulnar collaterals, and then those who are coming from the top, radial and ulnar. Yeah, there. Here it is, same thing. The nerves, here, if you have to identify the nerves, what's the big deal? Median nerve is forward, ulnar nerve, which is in the posterior compartment, done. Again, almost the same thing, right? All the structures, they are now known to you. Here, same thing. So this is, as it goes down, right, it leads to palmar carpal branches. Right? These arteries, when they come down, so they'll be giving the branches to all the carpal bones. So they are now called as the palmar carpal branches. Later on, they'll be giving the branches to the digits also, right? Now here is the radial nerve. Radial nerve, the deep branch will be giving cutaneous innervation. Finished. Then there is superficial branch, right? This superficial branch will be giving again the cutaneous innervation. So this is cutaneous nerve of forearm. But then two areas are, one is lateral, one is posterior. Lateral cutaneous nerve of forearm, ये तो अपना all time musculocutaneous, right? So from musculocutaneous, which is a branch of
Lateral cord.
Lateral cord.
Lateral cord.
So that musculocutaneous, as it is coming down, lateral cutaneous nerve of forearm. While this superficial branch of radial nerve, that is posterior cutaneous nerve of forearm. So this part is done. And then on the medial side, we have got the medial cord, and कब से बात कर रहे थे, this nerve was waiting, medial cutaneous nerve of forearm, which comes directly from the medial cord, right? Those small branches. So this medial cutaneous nerve of forearm, it comes down and then divides into anterior and posterior cutaneous innervations. So it is taking care of the entire medial side. Right? To make it simple, what I did was this. So here is the musculocutaneous muscle part, right? This is the muscle part, and it pierces coracobrachialis, and it gives biceps brachii and the brachioradialis, right? And then for the cutaneous, this is the lateral cutaneous nerve of forearm. Right? ये ना मैंने चोरी करके लिखा है. Examiner is planning to ask questions from this topic, so I thought कि आपको बता दूं. Then this is the radial nerve. Radial nerve starts from posterior cord. Root value C5 to T1, obviously, no? Right. And then this is the radial groove. It passes through the radial groove, and then it pierces lateral intermuscular septum, correct? And then it comes onto the anterior side. Yes, you know that. Radial, naam hi hai radial, so obviously it will be on the radial side. This radial nerve, this is like a summary, which is not complete, by the way. Sorry. Next time, we'll be adding the second portion of this radial nerve, because radial nerve is so important. It is not only this much. It is not only in axilla. It is not only in arm, but it will be supplying several muscles into the hand also. So that's why this is interval se pehle ka hai radial nerve. Interval ke baad ka radial nerve, it will be next time. So here is, our journey starts from axilla. Right, in axilla, the muscular component. Radial nerve is a mixed component, mixed nerve. So one is the muscular, second component is the cutaneous, that is the sensory. So this is the muscular, it supplies triceps. Okay? Long head, medial head in axilla. Before that groove, right? and for the cutaneous, posterior cutaneous nerve of arm, right? So remember, posterior cutaneous nerve of arm, posterior side of arm, right? So that branch goes from there. Now we come to arm. In arm, it supplies which muscles? It supplies triceps, lateral head, but exam ke liye, remember this, right? Which head has got the dual supply? The medial
Medial.
head.
Medial
Medial
head.
head of triceps has got the dual supply. One branch into the axilla, second branch after the radial groove, right? Then there's a small muscle called inconius, right? Then there is brachioradialis. And then there is this ECRL,
Extensor carpi.
extensor carpi radialis longus. These are the muscles. For the cutaneous innervation, lateral cutaneous nerve of arm, inferior, right? So this is the inferior lateral cutaneous nerve of arm. And then there is posterior cutaneous nerve of forearm. So lateral cutaneous nerve of forearm was from
Bus.
Musculocutaneous.
Shabash. Very good. Very good. Very good. So now we know it all well. Lateral cutaneous nerve of forearm, that is from musculocutaneous. This is the radial nerve which will be handling. Medial cutaneous nerve of forearm is coming directly from the medial cord, and we have got the median nerve, and then there is a shocking ulnar nerve. All right. Okay. So many queries. Kya hai queries? Most of the forearm extension must be in the. Most of the forearm extensors, they are on the posterior side. Totally agree. Most of them. Yes, Arya. Why is called recurrent? Those recurrent isliye that this is the current, right? The flow of the blood. So flow of the blood, that will be from top to bottom, right? It will go like that. But when ulti Ganga bahni hai, right? When we have to go back, so then that is called as the recurrent, against the current, ulta. So that's why they will be always called as the recurrent. If it is in the same direction, so then we call it a collateral. So that's why blood flow direction is this. So things which are going like this, we say is as collateral. Things which are going in reverse direction, we call it recurrent, right? And that's how it really goes. Can it be asked in exam? हाँ बिल्कुल. इनमें तो पेपर लीक करने बैठे हैं ना. These are the palmar branches. Palmar means easy, right? Branches to the palm region. Yes. क्या पूछे इसमें? You know all these. Radial recurrent against the flow. उल्टी जा रही है. This is the radial nerve's deep branch. You know that. This is the radial nerve superficial branch. It will be going down, right? Then the radial artery. This is ulnar artery. Then there is ulnar nerve because it is posterior, right? This is the brachial artery, right? ये कौन है?
Common interosseous.
Common interosseous.
CIA.
CIA. Yes, you know this. Now the orientation is changing slightly. Again, focus. There should not be any confusion कि हाथ अभी कौन सी position में है. It's not anterior, right? Now it is slightly rotated. कैसे पता चला? Because when it is slightly rotated, then we know ना कि otherwise when it was straight, so we were watching the supinator and the pronator quadratus like this, है ना? When it was absolutely front, but now it is slightly rotated. When it is slightly rotated, we see that pronator quadratus, वो तो पता चला, right? Supinator, yes, supinator now is seen much better. And then this EPB was extensor
pollicis
Pollicis
brevis.
brevis.
Extensor pollicis brevis. Watch this, keep it in mind and watch this. Now, yes, got it. This is the extensor pollicis brevis, which was coming from behind and it was going like this. But so in that image, now as if we are watching from this angle, right? So that this extensor pollicis brevis is seen very clearly. Here it is. Yes, clear? What right? We are watching at an angle, so that's why this is seen clearly. Extensor pollicis brevis. So this
Lateral
is
posterior.
so here is our right hand. We are watching the right hand. This is the right forearm, correct? This is the extensor component which we are watching. Yes, because this is posterior, right? So that is posterior view, right? Or the angular
So,
view. You can say something like an angle. हाँ अमन, want to ask anything?
यहाँ पे extensor pollicis brevis radius के anterior part पे जा
Correct, correct.
तो वहाँ
Right?
पे तो
It is,
interosseous है.
but it is winding around. But basically, this is pollicis. Pollicis, it means it will be heading towards the thumb. Thumb, right? It is heading towards the thumb.
सर तो जो interosseous membrane होता है वो ये pronator quadratus और extensor pollicis brevis के साथ mix हो जाता है.
Yes, ऐसे, right? That is how it goes. So to this, now we know this extensor pollicis brevis, right? It is at this point when we say this supinator, it was a deep muscle. So that is clear, right? Supinator was a deep muscle. Then we have got extensor carpi radialis brevis. इसके ऊपर था extensor carpi radialis
Longest.
So here we have removed extensor carpi radialis longus. From this point, for next few pages, be properly oriented. Acha. Meantime, because we are watching at an angle, we are watching from the posterior side, to the deepest on the flexor side can be seen, right? The way we were able to see that medial head of triceps, है ना? When we were watching from anterior to medial head पहले दिखता था. So same way, this is flexor digitorum profundus is watching because it is the deepest one, correct? And this is extensor pollicis brevis, we know that. But for the index finger, now till this point, this thumb was given importance. This first finger, इसके लिए special muscle. That is for the index finger and it is called as extensor indicis. So here is that muscle, extensor indicis. Hand is so complex, it can do so many things. Rotations are possible, right? Thanks to all these muscles. All these muscles in a combined form, they actually take control over the entire hand, right? And imagine their nerve supply and their representation into the brain. When we'll be studying the brain, we'll see that how beautifully the entire hand, right? You must have seen this figure, that if this is the brain, to then ye naak, these are the lips, right? Itna bada face. And then the hand is also represented like this, big. Because face and hand, they can create so many expressions. They can do so many things. So that's why they are given bigger area onto the cerebral cortex, right? Back ke liye, there is only small patti, very thin strip. I mean, with back, what you can do? Just this, nothing more can be done. You know, so there is a very thin strip. Though muscles are big, but they say that yes, inko to kya bas contract, relax, nothing more, right? So this is how it is. So extensor indicis. Now we are adding something interesting. There is one question which will invariably come, and that is what is called as the anatomical snuff box, right? Anatomical snuff box. Snuff means वो नस्वार, right? नशे के लिए सुनते. In olden days, right? They must be putting it over here and then करके, right? And then they come in the Raja part. So that is what is called as the anatomical snuff box. It is nothing but a depression, right? When you do like this, you'll find that there would be a depression, right? Just onto your radial side, there is a small depression. The boundaries of that anatomical snuff box is asked. So let's decipher it. First, with the things which we already know. So here it is. Supinator, we know that. Extensor carpi radialis brevis and longus both, right? So we have introduced that also. So these two muscles, they are done. Okay. Then supinator, so this muscle is also done. So that is also gone. Right. Flexor digitorum profundus, because it is the deepest muscle, that's why it is seen. Then extensor pollicis longus. Right. We have got now three muscles. One, extensor pollicis brevis, which we already discussed. Right, extensor pollicis brevis. To this, we are adding abductor pollicis. Abductor pollicis, right? For this is the abduction, adduction, abduction, adduction. This is done with the muscles which are into the palm, right? We'll come to that. But for the thumb, it is different. So for thumb, this is the abductor pollicis longus. Abduction means going away. So abductor pollicis longus, one side, and extensor pollicis brevis, so we are already, so they are together. So this is the abductor pollicis longus and extensor pollicis brevis. They are together. On the opposite side, this is extensor pollicis longus. This is the muscle which we are talking about. Longus and pollicis, that means it will be going towards the thumb.
Thumb.
Right? So this is the thing. So here is simplified figure. That's the anatomical snuff box. This is a space which is created, right? On one side, we have got the abductor pollicis longus. That is one. And we have got the extensor pollicis brevis, which is two. And the third one is extensor pollicis longus, right? So these are the pollicis. Because we are dealing with thumb, so that's why all the muscles, they are related to thumb, right? So
Sir?
Huh.
So extensor indices will not be the boundary.
Extensor indices, right? Extensor indices, I'll show you, right? Just in the next. Here is the extensor indices, right?
So sir, it will be the boundary, right?
Yes, but boundary would be formed by this extensor pollicis longus. Just underneath it, this is the extensor indices will be going.
Okay.
So it will be exactly like, say, this is one muscle, and then there is one more muscle, which is like this. So when we say about the boundary is here, right? So this will be the extensor pollicis longus, and extensor indicis is here. So if this is the anatomical snuff box, that's why we say that extensor pollicis longus is the boundary, right? Extensor indicis is slightly off. So now let's combine, right? Now this is like we are purely watching. Your answer. Here it is the anatomical snuff box. I'll mark it in red over here, right? It is in red. Yeah. So the boundaries, we watch extensor pollicis longus, correct? This is the boundary. And on opposite side, we have this extensor pollicis brevis and abductor pollicis longus. So this 1, 2, 3 done. Extensor indices slightly off. So that is the extensor indices. Meantime, we have got this flexor carpi ulnaris, right, which is on the opposite side. And over here, extensor carpi radialis brevis, and superficial to that is extensor carpi radialis longus. So far,
Sir,
huh?
how is the abductor pollicis longus the border?
How is the abductor pollicis is the border? Dekho. See, this is the muscle, right? This is the muscle. It winds around and it comes like this, right? This. So it winds around and it comes. So that's why it forms the border. It is this area what we are talking about. That's the anatomical snuff box. Now got it?
Yes.
Right? So we have got the extensor pollicis brevis, वो तो मतलब clearly here. Then extensor pollicis longus. So this one and this one. And then we have got this abductor pollicis longus, which is starting from above, but then it winds around and thus it is taking part into the boundary. Meantime, extensor carpi radialis longus and brevis, we know now this thing very well, right? One is superficial and longus is deep. Till this point, we were making the pairs, extensor carpi radialis, so then there has to be extensor carpi ulnaris. For radialis, this is longus brevis. For extensor carpi ulnaris side, just one. The way it was like flexor carpi ulnaris, so then there is another muscle which is exactly on doing the opposite function, is the extensor carpi ulnaris. So that is done. So we now know extensor carpi ulnaris, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor carpi radialis longus, and extensor carpi radialis brevis. But every time we are talking about the wrist over here, right? We are talking about the thumb over here. We are talking about the index finger, that is first finger, right? Our finger, index finger over here. So then starts extensor digitorum minimi. This is for that little finger, right? The muscle bhi chota sa, but this is extensor digitorum minimi. Well, given importance to that little finger, right? It is this putty, this one, that thin one. So that is it's going extensor digitorum minimi. Now, all put together, no confusion, right? Starting with what we know that easily. This is which side? This is pata hai chal gaya, dekhte, right? This is, we are watching from the extensor component. So extensor carpi radialis longus, more superficial. Then extensor carpi radialis brevis, uske niche. Then comes the extensor digitorum, correct? Then this is the extensor carpi ulnaris, right? Because then this is the flexor carpi ulnaris, that is also good. And here is the formation of anatomical snuff box. We have got the abductor pollicis longus and extensor pollicis brevis. And then the potential space which is created, that is what is called as the anatomical snuff box. And on other side, there is extensor pollicis longus. Good.
Sir,
Huh?
extensor digitorum is above extensor digiti minimi.
Yes, that's right. That's right. Extensor digitorum is above extensor digiti minimi. That's
Okay,
right.
sir.
That's right. And on top of it, we just added this brachioradialis, right? And this is extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, underneath extensor digiti minimi. And then there is extensor carpi ulnaris, right? And this is our anatomical snuff box in the form of abductor pollicis longus and extensor pollicis brevis. And on the opposite side, this is extensor pollicis longus, right? Let's say carpi ulnaris, just one, now that you know it. Okay, over here, we remove extensor digitorum, right? Extensor digitorum. So then immediately we start watching which one is this?
Extensor digiti minimi.
Extensor digiti
That's
minimi.
right. Extensor digiti minimi. Perfect. Perfect. Right. So here is the abductor pollicis longus, extensor pollicis brevis, and extensor indicis, and extensor pollicis longus. So this one will make the boundary of anatomical
Snuff.
We have removed extensor digitorum, right? You move further. Once again, we are going towards the bone, right? Extensor digitorum, you move. Okay. And now it is labeled. So over here, it was for practice. Okay. Now we have removed what? Watch. Extensor carpi ulnaris. So when I say we remove that, you should be able to visualize, this is removed, right? Extensor carpi ulnaris. So that is removed. Extensor digiti minimi, that thin muscle, that is also removed. And flexor carpi ulnaris, flexor carpi ulnaris, that is also removed. So we can see this extensor carpi radialis brevis and radialis longus. Yes, that is easy. Supinator, always easy. Then here it is, our anatomical snuff box and the extra. So this is the abductor pollicis longus, extensor pollicis brevis. Then we have got this space, anatomical snuff box and extensor pollicis longus. This is done. And just behind it, extensor pollicis longus, just behind it, this is the extensor indicis. Done. Now we remove longus, ECRL, right? Extensor carpi radialis longus we removed. We remove abductor pollicis longus, extensor pollicis longus, right? All those remove. So what is left out? The deeper muscles. Supinator is seen more clearly. Flexor digitorum profundus is seen clearly, right? Because that's the deepest one. Then extensor carpi radialis brevis, because we have removed the longus, and extensor pollicis brevis. And over here, extensor indicis and the pronator.
Pronator quadrant.
अच्छा, now you can appreciate external indicis is, देखा कितना दूर है, because it will be going for that index finger. And finally, all of them, flexor digitorum profundus, that is removed. Extensor carpi radialis brevis, that is removed. External indicis is removed. So we are left out with the deepest of the muscles, supinator, pronator quadratus, and the extensor pollicis brevis. Correct. This is from where we started our journey, and we removed that also. So now we are back to bones. So it is like bone to bone, and done. Saved. Right. Do revise this thing. Right. आराम से बैठ के मस्त strong cup of coffee, and because examiner will be asking so many questions from this, so he'll try to trick you from right side, left side. Possible एक image right के दिखाई, immediately next image जो है that might be of the left side. So it can happen like that. ठीक है? So don't be confused, right? And wait, regarding हाँ बिल्कुल बिल्कुल, there is flexor pollicis, आएंगे. Then now the best part is, next time when we'll be studying the hand, you will find all those muscles, they are intrinsic muscles. So there'll be small muscles which are into the hand only, right? We have discussed right now extrinsic muscles, which are starting from forearm all the way they are going into. Still more interesting would be that how these things, they will be landing on digits, right? They will be making, they'll be like this, and then in between one muscle will be landing like this. So there are digits, right? There are digits. So they'll be landing like this, and then there will be landing like this, so that you can make various shapes with your fingers, right? Thanks to all these muscles. By the way, which nerve I am testing? Fast.
Ulnar.
Shabash.
Allah.
Good. So thank you so much. Have a nice weekend.
Thank
Wish
you.
India that Sunday jeet jaye.
Thank you.
Because it is
Thank
the
you, sir.
final.
Thank you, sir.
Finals mein mood is always very different, right? Though out of last 17 encounters we have won 16 times, but it will be a great thing. And Trump ko kuch sadbuddhi de. So thank you so much. Take care.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Sir, bye, sir.